This year, the winner of the Outstanding Rural Health Program is the Northeast Kentucky Substance Use Response Coalition. This formal network of healthcare and social service organizations represents 18 counties and is focused on building a community-based approach to address the region's opioid crisis.
3 years ago, a small group of employees from St. Clair Healthcare and the Northeast Kentucky Area Health Education Center wanted to make positive change to address the substance use epidemic within northeastern Kentucky. But the problem was far too big for any one organization to tackle on its own. Overdose rates within this area are much higher than the state, Appalachian, and national averages, according to the NRHA overdose mapping tool. Thus, the Northeast Kentucky Substance Use Response Coalition was formed. The coalition is now a formal network of healthcare and social service organizations representing 18 counties, focused on building a community-based approach to addressing our region's opioid and substance use crisis. Coalition members represent multiple sectors and include St. Clair Healthcare and its hosted Northeast Kentucky Area Health Education Center, Achieving Recovery Together, a recovery community organization, the Clark County Health Department, Comprehend Inc. and Pathways Inc. Community Mental Health Centers, Tri-State Primary Care, the Kentucky Rural Healthcare Information Organization, and the Gateway District Health Department. Organizing multiple community partners to work together instead of functioning in silos allowed for better coordination of services and reduced any duplication of effort or programming. As the coalition formalized, establishing bylaws and a governing board, its impact continued to grow. To date, the coalition has been awarded 6 federal grant projects, which brought more than $3.4 million worth of funding into the service region. More importantly, this funding has enabled the coalition to facilitate meaningful projects, gather data, and establish much-needed interventions within local communities. Across our 6 projects, we've conducted interviews with incarcerated individuals concerning addiction, treatment, and recovery, administered an MAT survey to more than 100 healthcare providers and administrators, expanded or implemented MAT within 4 rural health clinics, established a series of MAT trainings and MAT mentorship for local healthcare providers, delivered prevention education presentations to hundreds of young students, distributed naloxone and trained community members on its use, and created a jail reentry program called First Day Forward, which pairs incarcerated individuals with a trusted peer support professional who works with them prior to and post-release. On behalf of the Northeast Kentucky Substance Use Response Coalition, I would like to thank the selection committee for choosing us to be the National Rural Health Association's 2021 Outstanding Rural Health Program. We are honored to be chosen from the other amazing programs across the nation. When it comes to the work that we do, we have a saying within the coalition: if we can just help one person reach one person, all of this will be worth it. To know our efforts are being recognized on a national scale and that other healthcare organizations may observe and model the types of programming we do, that adds a whole nother level to the impact that we could have in addressing this epidemic. Again, we thank you for the recognition and the opportunity.
Congratulations to this extraordinary program.